Hi, my name is Linda Okafor, and in this final reflective journal, I have some questions to address. The first one is the goals I set for myself at the beginning of the semester. So, at the beginning of the semester, I set 3 goals for myself. Number 1 is to enhance my ability to manage psychopharmacology, ensuring appropriate medication management for patients across the lifespan. And I am glad to say that I met this goal. Number 2 is to deepen my understanding of psychotherapy techniques, especially those that are culturally sensitive and trauma informed. I would say I met this goal by 80%. And number 3 is to develop strong interdisciplinary collaboration skills, working effectively with other healthcare providers for comprehensive patient care. I will say I met this goal about 50% because most of our clinical sites they conduct the collaboration by themselves. They do not allow us to participate in the collaboration, and the reason they gave was because of continuity, that tomorrow we might not be there. The second question is feelings of prejudice and biases experienced during clinical experience. Throughout my clinical rotation, I noticed feelings of discomfort and uncertainty when working with patients who had complex trauma histories on certain personality disorders. Initially, I struggled with my own biases, particularly around patients who exhibit manipulative behaviors or resistant treatment. Another is to manage these feelings and biases. I practice active reflection after each patient interaction. I reminded myself of the underlying reasons for the patient's behavior and maintained empathy, recognizing that resistance or manipulation could be rooted in their trauma or fear. Engaging in conversation with my supervisors and peers helped normalize these emotions and gave me a broader perspective. Managing anxiety, self-doubt, and uncertainty. Anxiety and self-doubt were common, especially when faced with complex cases or difficult patient interactions. To manage these feelings, I utilized grounding exercises before patient interactions to stay focused and calm. I also reviewed the previous encounters to understand the patient a little more beyond their current chief complaint. I sought regular feedback from my preceptors and peers, which reassured me when I doubted my abilities. Practicing mindfulness helped me stay focused during the clinical encounters, reducing my anxiety about making mistakes. Insight developed during clinical experience. I gained significant insight into the importance of patients, active listening, and empathy in psychiatric care. Understanding that each patient has a unique story helped me become more compassionate and less judgmental. I also recognized that self-awareness is key to avoiding burnout and providing better care. By recognizing my own triggers and addressing them, I can maintain emotional balance and be more effective in my practice. Has reflective practice impacted you? Absolutely. Reflective practice has not only enhanced my self-awareness, but also improved my ability to provide empathetic care. It has helped me grow as a student, becoming more open to feedback, and as a provider, helping me connect more meaningfully with patients. Personally, reflection has allowed me to better manage my own stress and emotional well-being is a critical skill in mental health practice. Will I continue to use reflection in the future? Yes, I plan to continue using reflective practice in my future work. Regular self-reflection will allow me to stay grounded, address any emerging biases or emotions, and continuously improve my clinical skills. Reflection provides a pathway for personal growth and ensures that I remain mindful of my strengths and limitations as a practitioner. I intend to schedule time for reflection after particularly challenging patient encounters or at the end of each week, documenting these experiences to track my progress and identify areas for ongoing development. Thank you very much.